Right.
Hello, my name is Stuart. I'm 76 years old, and 3 weeks ago I had spinal surgery with an incision on the right side of my neck to remove a disc and steady the ship, as it were, to prevent my spinal cord being compromised and causing some of the problems that I had originally come in to see Professor Ranganathan for. My wife brought me in thinking it was a good idea to see him, and I'm really glad I did. Always explained to me that why this was something that needed to be done urgently, because without the surgery I could have ended up in a wheelchair, or even worse, find myself being paralysed by the effect of this pressure on my spinal cord. And it was very carefully explained to me by Professor Ranganathan also that the risks of the surgery were considerable. Because of my heart condition and the fact that during the operation my blood pressure needed to be kept high because of that, that was a further risk of possible paralysis, death on the table, or a stroke during the operation. And I decided that the possibility of spending the rest of my life in a wheelchair and not being able to walk, go out with my dogs, etc., was too much to bear. So I decided that the operation was the only choice, and I'm really glad I did. I'm 3 weeks down the road. I've had hardly any pain at all from any sorts from the operation site, and bingo, I think is one of the best things I've decided to do, apart from the fact of marrying my lovely wife, of course, who was really quite responsible for sort of persuading me to have this done, and it was the right thing to do.
Absolutely.
Definitely.
Absolutely. I mean, I had my own surgery 7 years ago, so I just knew that he had to have this operation. Professor Ranganathan was the right person for the job. We didn't really even have to think about it. If a life in a wheelchair or no life at all, and we just knew that having it done would be the best thing. And he's been fine ever since. It takes time to get over any operation, but I think to be 76 and to go through this was remarkable. The best thing we did. So I think we would advise anybody in the same situation to actually go for it and not think, oh no, I won't have it done. No, go for it. Best thing, the best thing that he did. Absolutely.
Yeah, I agree. I must say, the care taken by the nurses, etc., in the Princess Grace Hospital was phenomenal. The surgical team was really skilled and experienced, with a wonderful anaesthetist.
Yes.
And specialist nurses. So, you know, this is the thing to do. Be brave, and I would say there's a very, very, very good chance of you coming through it and being, your sort of life conditions are being improved.